picture of the very first patient that I treated on the graph showing a resolution of symptoms.
And dramatic resolution of symptoms in a large proportion of
Yeah.
cases. And I've had the privilege of meeting some of your patients who
Yeah, that's right. You have. Yes.
concur completely with what we've just said. And the other thing that struck me about this, more a philosophical point really, but man-made drugs tend to focus that particular reaction or that highly specific bit there, whereas these, whatever you like, God-made, created, natural molecules, have got multiple modalities of action. I mean, Gustav Gleisch was looking at, I think it was a thalidomide-based one. And the authors actually said, stop giving us new mechanisms. We've got too many. There's so many multiple mechanisms.
It makes a logical sense, though, doesn't it? That you've got a plant and it doesn't know what pathogen is going to attack it. So it has to put in place a mechanism that's broad. And so it's very clever. It said, look, we can't pick every bug, every bacteria, every virus that might come our way. We'll just simply make our cells in the plant less able to do what those outside pathogens want to happen. We won't let them take over our machinery. We'll block them. And so you've got these multiple changes.
Which is consistent with your own research as well, of course, giving oral bacterial preparations that stimulate, upgrade the mucosal immune system altogether rather than a specific vaccine for that and a specific pill for that. We've got this. Just to give us a bit of background about that, just briefly, Robert, on that one. It's because basically this is, I think what you and Gustav Gleisch have done on this is nobilizable, but it's just been ignored.
No. Very briefly, my view is that as an immunologist and a clinical immunologist, that all the various different vaccines you want to use against an inhaled virus, which is likely to be the usual pandemics that we see, flu, COVID, etc., they attack a system of the immune process that is different to the one you inject the vaccine into.
Yep.
And so the bottom line is that it's the biology of the process that's going to dominate the outcome, not whether you use a messenger RNA vaccine, a DNA vaccine, or a squashed up virus or whatever.
Yeah.
It's the limitations are set by the biology of that interplay between the virus and the local immune response and the suppression of immunity that goes with that to prevent overactive inflammation in the airways, full stop.
Yeah.
So my group, we said initially, we didn't say this, but we said this through COVID when we realised what was happening, that you're never ever going to have a fantastic virus against a pandemic. It's got to be
fantastic vaccine, yeah.
Sorry, a fantastic vaccine
Yeah.
against a pathogenic virus coming in like this. Something might happen that changes that view, and I hope it does. But at the moment, that's how it is. What perhaps we need to do is look at why is it that if 100 people get COVID, 98% of them will just get a cold, a minor problem. 2% will get a serious disease. And so we developed the idea that why can't we find out what makes a person get bad disease, and let's make that person be like the person who gets good disease.
Yeah.
And we actually worked that out on work we've been doing over the last 40 years, actually, that it's the delivery of the immune system to the airways, which is less effective in about 20-25% of people. And you can correct that delivery with a very simple mechanism, and that is feed the stimulus, which happens to be from the microbiome of the airways, a particular bacteria. We kill it, we feed it, and all of a sudden the numbers go up, and the people, if you've got bad lungs and you get lots of chronic bronchitis, you stop coughing, you stop getting acute exacerbations. If you've got reasonably good lungs, but you're prone to getting colds going to your chest, you get a cold and you're coughing up mucky sputum, then it stops that. So we shift the resilience of the airways. It's so simple, but people don't sort of get it, and people don't want to invest in a kill bacteria because it's so simple.
Yeah.
So we're trying very hard we're getting people. We're hoping people can get this message and realise that they could financially do quite well out of it. I suspect if they do invest.
Well,
but
yeah.
That's where it's at. So
I mean, the number of people that I've seen die from exacerbations of chronic bronchitis and pneumonia, often at a relatively young age, and the idea that this is, to give one vaccine to prevent one particular bug, but then of course you might get an infection with another bug, and that's going to be useless. But yours affects. It upgrades the entire mucosal system.
Upregulates the responsiveness. In fact, in people with COPD, chronic airways disease, it's the only medication that reduces admission to hospital by 50%. The $100 billion industry taking asthma treatment and people taking it because they get a little bit of symptomatic relief does basically nothing about preventing serious disease. And yet we can change that up to 50% in 8 randomised controlled trials for those who follow the COVID story.
And Gustav Gleich likewise has the data for his systemic upgrade of the T cell response.
Also with non-specific outcomes.
Yes, with a wide range of outcomes from cancer to common colds and influenza. And personally, my T cells could do with all the help they can get, thank you very much, but they're simply not available, infuriatingly, as we've covered in previous videos. But basically regulators aren't it appears the regulators in this country have deliberately blocked simple things that are, how could I put this, safe and effective.
I think basically biomedical science is trained to think in a very specific way. And I look at, when I was working in North America, PhD students, not so much in Canada where I was, but certainly a lot of parts of the United States, they would become unbelievably knowledgeable about a tiny weeny bit of a virus or a little bit of an antibody. But they would specialise even going through medicine. And I think we were lucky in Australia. We had the British system and the Canadians had the British system. And I guess...
The old British system.
Well, it was a great system, and we inherited. We had to know how to take out an appendix, believe it or not, how to deliver a baby.
Well, I thought that's pretty handy if you're in the outback.
I wanted to be an immunologist.
Yeah.
I had 5 babies. The first one was named after me. I proudly can say.
Wow, congratulations, fantastic. Yeah, I mean, one of the phrases that came up was cognitive dissonance in society. People are genuinely confused now, aren't they?
Yeah, it's brainwashing, isn't it?
Information control.
It's just a term for me. I think we say cognitive dissonance because it sounds a bit more technical than brainwashing. But I've got so many medical friends that, I mean, they humour me. They're nice to me about it. But I know they don't believe me. And I know that it's not me so much, that no one wants to look at the science, which is just getting stronger and stronger. Exactly. Because I don't know what drives the psychology of cognitive dissonance, but the big pharma companies really did a job on us and did it very well. Look, we've got, I'll tell you a great story if I haven't told
please do.
Well, in this country, we've got every university's tied into a system that's going to make them a lot of money, mainly with Moderna, a company which seems to be doing very poorly elsewhere in the world, but they do very well out here. And they've poured money into, including, $100 million here and there. And they opened a factory at Monash University where I got my PhD, so I've got to be very careful what I say. They might take it back. And they opened this with a promise that they would be making 100 million doses of vaccine a year.
As a boast.
That's a lot of arms.
Yeah.
And they had the Premier of Victoria opening this. This is just a few weeks ago, or a month, maybe 2 months ago. And she got up and she said, well, every mother in Australia is going to be they're going to know the word RSV, respiratory syncytial disease virus, because guess what? Moderna's making this terrific new messenger RNA vaccine for the babies. Now,
Babies and children.
you'd be aware that very cleverly they'd been bringing in this messenger RNA vaccine through the older people, suddenly discovering these, some of us physicians hardly knew existed, that everyone gets RSV all the time, but suddenly it became a life-threatening disease requiring a vaccine.
Yep.
And so gradually it's come down in age, and they were doing a trial in infants. Now, any immunologist who knows the stories, it can go back to the 70s and 80s, knows that the one infection you don't fiddle with and play around with the IgG antibody is RSV, because they had catastrophic outcomes, with some kids even dying, getting very serious RSV infections through antibody-promoted serious infection.
Yep.
I think it was the day after the Premier got up and said, every mother is going to know about this disease. Terrific. The next day, in very small print, in an obscure journal, Moderna said, we're putting the study on pause. And I love this one wonderful word, pause. And the reason was, incidentally, 12.5% of the injected infants got life-threatening RSV infection in the... Now,
you couldn't make it. I mean, 12.5%. You couldn't make it up.
It's 1 in 8. 1 in 8. 1 in 8 kids. As soon as they picked up the infection, instead of getting better as the vaccine was supposed to make, they got life-threatening infection. They got promotion of infection. And that's one of the stories that, of course, comes out of the whole COVID era.
And that's the whole thing that, if they come to ask you a couple of years ago, you could have told them that. There's so much here that could be anticipated.
Totally predictable. Totally predictable.
Yeah. We could go on all day, Robert, I know, but I mean, really...
All night.
Yeah, all night for you, sorry. Yeah, you're so far behind, or are you ahead? I think you're ahead, actually, in Australia. The future, Robert, where do we go?
Oh, dear. Well, I think I'm hoping that some of these big law cases that are occurring now, again, across the vaccinated world, we have 2 or 3 in Australia, I hope they win, that you can win. So far, they've been shut down by clever lawyers. I don't know, I won't go into why I think they're shut down, but there's a glimmer of hope that some of these cases now are proceeding. And I think it's only going to be some dramatic event that gets attention, so it gets into the mainstream press. The mainstream press is changing. There are articles coming out that are good. There was an amazing article showing that Paxlovid doesn't work. And it was quite... look, you're going to like this too, John. Wait 1 second, I want to show you something.
Please.
Here we are. I've kept this. The story about Paxlovid came out, and it was published in the Sydney Morning Herald, which is a fairly left-wing paper in this country. And the next day, in another newspaper, here is a full-page advertisement by, in very small print, I think it says Pfizer, saying, look, if you stay ahead of COVID, be ready to fight back. Know you're eligible for antiviral medications. This is unbelievable. And my wife was travelling in the metro trains in Sydney at the same time. She said, there's huge advertisements in the train. Go and buy this useless drug. That actually can cause you some problems. I mean, people have actually died as a result of taking Paxlovid, as you know. But isn't that wonderful? Wonderful. I'm going to put it up. I'm going to get it framed, actually.
Yeah.
Inside the Sydney Morning Herald article that states it doesn't work.
Yeah, some inconsistencies there. I think it's safe to say.
Just a coincidence.
Yeah. I mean.
But you see,
I agree. There's hope in all this
sort
of litigation aspect, but
look, no, the comment you made a few minutes ago about cognitive dissonance. that family practitioners have been hit with this so much that they believe it. And they don't see, the article in the paper was in pretty small part of the paper, but it was there. But they probably don't see that. And they have these drug reps coming and saying, look, this is fantastic drug. Quote some minor study somewhere that says it's marginally beneficial. And molnupiravir is even worse. It's can you get it in England?
I believe it has been used. I don't know if it still is.
It's certainly every second patient over 60 who goes off to the doctor with what gets this $1,000 drug prescribed for them because the family practitioner doesn't realise that the data on ivermectin is so good.
Yep, and the just blind following of the guidelines. So I agree with it. The legal side can do some things, but really you would hope for a return to basic science, application of basic science, learning from empiricism, learning from clinical practice.
But John, the institutions and the universities have been bought.
Yeah,
they're all part of this complex.
And the journals are so compromised now as well.
And the journals are compromised terribly. Yeah, I've written I better not say this because they haven't actually knocked it back yet. So I might tell you about this later.
Yeah. We'll just say for now that there's certainly more to come on this story, but at the moment it does sound a bit depressing. Anyway,
that's for a major journal.
Yeah. Forewarned is forearmed. Get the book, well worth it. Profits go to vaccine injured people, of whom sadly there are many. Truth and reconciliation, an honest understanding of the past is really necessary to move forward, and this is a significant contribution to that. Let's hope there's more to come. But for now, Professor, as always, great, really great to talk to you. Thank you so much.
Very nice talking with you, John.
Thank you.